Mr. Thibodeaux. How are you today? My name is Mary. I'm a nurse. I'm going to be performing a peripheral vascular exam on you. Basically, that's checking the blood flow of your upper extremities and your lower extremities, your arms and your legs. Make sure you have an adequate blood flow. Do you ever have any numbness or tingling in your arms or your legs or your hands or your feet? Okay, so we're going to start off the exam by looking at your upper extremities and comparing both of them for symmetry. And if they were not symmetrical, I would measure in different areas and note the differences. And then we're going to check for the temperature. With the back of my hand, I'm going to check and go all the way down to the fingertips, and I'm checking for the warmth of the skin, which is what you want it to be, warm and dry, and cool would indicate a lack of or diminished blood flow. So we're going to check this one over here, also warm all the way down to the fingertips. Now on inspection, I'm also going to look for any bruising, lesions, and things healing in various stages. What I do notice is a scar right here to the inner elbow on this arm. I'm going to inspect this one visually for any scarring, bruising, lesions, and I don't see any on that. Next, I'm going to check your pulses. I'm going to start off with your radial pulse. I'm going to feel here, very strong. I'm checking for the strength and the quality, and then I'm going to check this one as well. They're both very strong, and I'm going to check them both at the same time and make sure that they're equal bilaterally. Then I'm going to check the ulnar pulse on the other side. Good. And I'm going to check this one, and then I'm going to check them bilaterally for equal. And then I'm going to check the brachial pulse. Good and strong. And then I'm going to check this one over here. And then I'm going to check them bilaterally for equality. And they're both equal and strong. And then I'm going to check your fingers, your fingertips. I'm going to squeeze the fingertips, checking for the blood flow return down to the fingertips. Less than 2 seconds is what you should see when you squeeze the fingertip, and the blood will return. So you squeeze it, it turns white, blood flow returns immediately. So you're less than 2 seconds on that, which indicates a good blood return. I'm going to check this one over here. Oh, that's very good. I'll check this one over here, same thing. But also check for any clubbing on your fingers. That's a curvature of the fingernail downward. You actually see that in some respiratory deficiencies, asthma, COPD. You'll see the clubbing of the finger. You don't have any of your fingernails are normally straight, no bending of the nail. The nail would kind of bend over the finger like that. If it's okay, we'll check your legs. And I'm looking at the size as well and the development. They both look equally in size and well developed for your age. I'm going to check with the back of my hand the warmth as well, checking all the way down to the toes, all the way down. And I'll be feeling for coolness in the feet, which would indicate a lack of blood flow to the lower extremity. Also this one, all the way down. And good. With him, I'm going to be checking for, in the male population, we check for hair distribution. In the older population, hair loss is normal as you age. In the younger population, lack of hair on the legs or just parts of hair missing on the legs can be indicative of a decreased blood flow to the extremity. So his is normal. You have perfectly normal hair on both legs. We're going to check some pulses. We're going to check your dorsalis pedis pulse, which is right here. And if you follow right up the toe line, about midway up the foot, you can feel it. It should be very strong. Sometimes in the elderly population with decreased blood flow, it is not as strong, and you may have to use a Doppler, which is a device you put in your ears like a stethoscope, and you put it right on what you're trying to listen to for the pulse, and you can hear it then. Over here as well, and I'm going to check, and they're both very strong. And then I'm going to check the posterior tibial pulse, which is right here at the back of the ankle right here. Very strong. And I'm going to check this one as well. And then I'm gonna check your popliteal pulses right back here. These are a little bit harder to manipulate sometimes. If you bend your leg just a little bit, and you can feel it right in the middle of the knee right there. Sometimes you have to bend the leg. I'm gonna do this one too, bend that one up for me a little bit as well. Okay, and what we also check for is edema, which is swelling in the lower extremities. Maybe you stand up for me for a second. And I'm gonna check when you stand up that you don't have any swelling in your feet, which she doesn't have any swelling at all. And then also looking for bulging varicose veins. That indicates an increase in the pressure in the vein, and he does not have any. His veins are basically even with the skin for the most part. But I would note that in an assessment if there were bulging veins or any swelling, edema in the feet. I'm going to check your toenails for the capillary refill, and then we'll almost be finished with the exam. So we're going to squeeze these, make sure we get a good blood return back to the toes. That's also less than 2 seconds as well. And in my visual exam, I'm going to check for any scarring, bruising, a mole right here. Note that there's a couple of scars back here on the ankle, a scar right here on the foot, and a scar right here, all well-healed scars. Both legs are warm. Okay, I think you have good blood flow to your extremities. Thank you, Mr. Thibodeaux, for participating in the exam. This is Mary Thibodeaux, and that was a peripheral vascular exam.